How's it guys, and welcome back to my channel. This is that med guy. Today we're going to be doing tourniquets. I had a request and so I thought I'd just break it down quickly. So a tourniquet is obviously a band. It could be a belt or it could be a professional tourniquet which you put on a limb, or limb being arm or leg. I'd raise my leg if I could. This is obviously designed to stop bleeding. It is generally the last line of defense. You know, we're going to use direct pressure or indirect pressure, you know, all that first aid stuff, or elevation, but then tourniquet. So if there's a shark bite and someone loses their leg, we're probably not going to try and mess around with putting direct and indirect pressure. We're going to be going straight for a tourniquet. There's this video I watched which is very graphic, which I don't know where I saw it or whatever, but it was this terrible video of this guy who gets shot, and you see that he bleeds out in like less than 25 seconds, and it is very violent, but the video was being used to teach a point that we bleed out very, very quickly, and that when we don't apply tourniquets and when we don't take bleeding very seriously, it is a huge problem. So in like theater, wherever the case is, the two things that a surgeon will always struggle with is temperature and blood. They generally quite combine, because when you lose blood, you lose temperature, and when you put in blood, it's hard to warm it up, and so then they get cold blood, and then temperature drops, and XYZ, you understand the whole cascade. When it comes to tourniquets, there's a saying, it's high or die. What that really means is that rather than putting it like closer to the injury, you can actually put it quite far up. And remember, it should always go on a long bone. So don't go on like your tib fib or your radius and your ulna. Always go for your humerus or your femur. These are long bones, and you can go quite proximal, so like closer to your torso than further away, because you're more likely to get all the large arteries than if you go quite close to the joint. That's kind of the gist of that. The other part is to have this quite available, and then the other one is that some people are concerned that if they put it on, they're going to kill whatever is distal or whatever is on the other side of that tourniquet, which is not actually true. So they have studied that at least up to 2 hours, and the higher limit of that is 3 hours of having a tourniquet on, will have no prolonged damage to the tissue that is distal to the tourniquet. The point that is important with this is so that if you have someone who has massive bleeding, I have had it before, I applied a tourniquet straight away. I then assessed what was going on. I cleaned up all the blood so I could see what was happening, and I was quite happy that I applied the tourniquet because I could see vessels and I could see all the way through to his bone on his arm. And so then when I got to the hospital, they actually just released that tourniquet slowly to see what would happen, and the bleeding had stopped. So there is no issue with applying a tourniquet if you're not sure, and just documenting what time you applied it. And if you're in hospital within an hour, the doctor can always just remove it, and it's no real big problem. For instance, I had this call a long time ago where this gentleman cut his arm really badly, and they had applied a belt to his arm. He had cut by his elbow where there was quite a lot of vessels and there was blood everywhere, and they had applied a belt to it. So we just cleaned it up, we had a look, and we actually released the belt to see what would happen, and there was no bleeding. It's important to realize that a tourniquet is not just you apply it and then, well, that's that. It can be put on, it can be taken off. There are different kinds of tourniquets, obviously ones that are like got air, so a pneumatic one, so you can be very specific about pressure. And the other point that's really is quite important when it comes to tourniquets is that it should be as wide as possible. So if you were to take string and tie it around your arm, it's going to hurt your tissue and probably cause necrosis to the tissue where that string or rope is attached, just because it's such a thin compression line, because the area that the rope is covering is very small, where they actually recommend that a tourniquet should be about 3 centimeters or an inch wide, so that it's broader across the skin and doesn't cause the necrosis to the skin. So that's why a belt is actually not a bad idea, as long as it's not a thin, stringy belt. So the summary would be is high or die. Remember, put it up high. Put it on a long bone, so either your femurs or your humeruses, and that you can put it on and the doctors can take it off later. So don't be hesitant to put it on, and remember to always have it handy. So guys, hope you enjoyed this. If you did, please hit like and subscribe, and we'll see you in the next video. Bye for now.